About 11 years ago, a man by the name of Bruce Van Nostrum was a parishioner at Trinity Episcopal Church in Hattiesburg. And he was in the process of becoming a deacon in the church, and he felt called to work with people who were homeless and people who were living with HIV. And the AIDS Services Coalition was founded in about 2002 by a group of folks in Hattiesburg who were concerned about people who were living with HIV, who were losing their housing because of their status. We were very fortunate to become affiliated with the Mississippi Balance of State, or MUTE, very shortly thereafter. And because we worked with people who were HIV positive, we filled a gap in that continuum. But primarily, we're doing HIV testing, we're doing outreach, we're meeting people every day talking about how homelessness impacts our community as a whole, and I'm excited to be able to tell you that we're making a little bit of a dent every day. 10 staff. I have three case managers, 2 of whom work with 227 Place. 1 works at 121 Haven House. I have a housing program specialist who helps me bridge the gap between the two.
I work with the executive director, the financial aspects of the organization. I enjoy it very much because, for one thing, we are helping people, and that's something that I've always wanted to be able to do, and I do believe that our organization has helped a lot of people.
I have a house manager who helps me with 121 Haven House, the day-to-day runnings of the house. I have 3 outreach workers who do HIV testing and do outreach and prevention, homeless prevention and HIV prevention. We were funded for 121 Haven House, which is a transitional shelter that houses up to 10 men living with HIV for up to 2 years.
It's an interesting place to work. You meet different kinds of people. Sometimes people can be a bit challenging, and sometimes people are very accommodating in their personalities. They want to change, they want to grow.
It's a great place to get healthy and to change whatever reasons you were homeless.
My role and responsibility is to oversee the operations of the program. That entails assessing clients for eligibility, completing the intake, and also work with the clients while they're here in stabilizing, assisting them in stabilizing in their homelessness, so that it is a long process, and from admission to assessment to discharge.
As a part of our grant with HUD as well, we did outreach. Outreach is a critical part of working with people who are positive, because people who are positive are 6 times more likely to die of their illness if they're homeless. So we have an outreach staff that works to not only prevent HIV, but to help people who are positive remain in care. That is a critical component of our programming. As about a year ago, we took over a program from Forest General Hospital that was a program that they were no longer able to run, that was a HUD program called Green Meadows. It is a program for women and children who have a mental health issue or a substance abuse issue, and who are considered disabled by it. We were excited to be able to work with this program because we added an additional target of women and children who are HIV positive, which is a huge gap in our state. And people who are HIV positive struggle daily with that yoke that they bear of being positive. Unfortunately, the stigma in many cases keeps people from seeking services, not just health care, but housing. Mental health care is a huge issue within our population. We also have a huge issue with substance abuse. And I'm not sure in many cases which came first. We are about to open, hopefully this fall, a new facility that will be called Shealy Place. It is a permanent supportive housing program. We're purchasing 16 apartments. It's right next door to 121 Haven House, so it'll be a great addition to the neighborhood. we're very fortunate in this program and that the city of Hattiesburg is actually participating with us in this program with community development block grant monies. White House, I've been asked to participate in a White House briefing on HIV in the South, where I will discuss homelessness as a huge barrier for people who are living with HIV, and represent the South in that way to discuss homelessness and its impact on people who are positive. So I'm very happy to represent our area at the White House, and I hope that I'm able to tell the President that we need his help. About 7 years ago, and when he came into Haven House, we literally had to help him up the steps. He was a phenomenally addicted crack addict and very, very sick with his HIV. And he struggled with sobriety for the entire time he was in our facility, but he got it. And he has been sober now for right at 8 years. And he is in school, Dean's List. He is clean and sober and happy, living on his own, and attributes one to Haven House for saving his life.